name's Bridget. I'm currently in AIN at the North Canberra Hospital, working in the intensive care unit and coronary care unit. Um, I'm learning so much stuff, so much about the equipment, so much about the sicknesses that the patients are come in. Like the patients are at their sickest, but I'm really enjoying myself, and I'm really keen to um, join the new graduate registered nurse next year. For the questions, describe how you've used well-developed communication and interpersonal skills to ensure safe, effective care. Actively involve my patient in his or own care. I would use my interpersonal skills to be involved in shared decision making, and I would use my well-developed communication skills to meet my patient's information needs. I would do a full clinical handover on my patient. Communication is vital for the safety of my patient. Also, ensuring clinical communication and documentation are critical to patient safety. Question 2. Firstly, I would ensure that the patient's safety and assess the patient for any adverse effects. Take proper clinical action, calling the team leader or the doctor. Stay with the patient to ensure they are stable. Secondly, I would notify the RN in charge, incident reporting on Riskman, being honest and factual about the incident, reflect and learn from this, and take part in education and training if needed. I'd support my patient and family, ensuring compassion and an apology. To keep my patients safe when administering medications, use the 6 rights of medications. Check for any allergies. If so, what are they and the contradictions of the drug interaction? Use my clinical judgment. If I'm not sure about the drug, don't give it. Know about what the drug is that you're giving your patient. Communication with the patient, what the medications are for, and when administering is very important. Use technology safety with the scanning of the medication and the identity and of the patient, and checks with other RNs on the S4 and S8 medications. Adhere to the medication quality and standards, and I will keep my knowledge and skills up to date. When I'm feeling overwhelmed with high acuity of patient allocation, well, this happens in my AI job all the time. I'm always looking at the vital signs, making sure that they're comfortable, and getting them anything that they need. Using a shift planner for my shift really helps. Prioritizing my tasks. I can seek help whenever I need it. There's clinical educators, other staff members, team leaders to reduce the load, to get things I need for my patient ready, and that a high acuity doctor is there if I needed. Demonstrate understandings of the NSQHS standards and WHS at the Canberra Health Services, making sure I'm familiar with the 8 standards, being clinical governance, partnering with consumers, preventing and controlling infection, medication safety, communication for safety, comprehensive care, blood management, and recognising and responding to acute deterioration. When observing signs of patient deterioration, I escalate the care promptly using a MET call and the protocols, and monitor using the Muse score chart. I reflect on how the standards apply to my daily work. WHS, I understand that CHS is committed to providing a health service where we feel safe and we have a great environment to work in. And an example of doing our HRINS training, to be educated in such things as fire safeties, aseptic techniques, 5 steps of hand hygiene, those sort of things, emails for notifications and any work health safety changes, and report any hazard or risk that I might see. Please provide an example of your contribution to a positive patient experience. I must resonate with kindness. I am the AIN at the North Canberra Hospital, and sometimes I have to specialise patients for safety of their health and well-being. So dealing with a lot of patients with delirium and confusion, just being there if they need me. Also showing compassion and empathy to familiarise those loved ones who are critically ill or dying. So thank you for listening to me today. I really hope that I'm considered for the new graduate RM position next year. Thank you. Bye.